started so we can kind of stay on the agenda. I'm Lora Dwyer, St. Joe Community Health Foundation, just in case some of you don't know me. I first want to thank everyone for coming. We had 61 people register, so we've grown exponentially over the last year. Our average before was about 30 to 35, so thank you for your interest. Thank you for your support. On the table, I do have one request. Well, I have a couple requests. But next year in 2018, the foundation wants to develop a communication portal. We're not sure what that looks like yet, whether it's a website or a Facebook page or whatever, but we need your input. So you've got a pretty yellow piece of paper. Why you're eating and why we're getting started. If you could fill that out for us, it would really, really help, because we need to know how best to communicate with you as a group. And we want you to have access to all our materials and everything that's going on in the community. So, Laura, can you talk a little louder, please? I'll try. It is really as loud as I get. So anyway, any questions? Yellow survey, please fill it out. Also in your packet is the evaluation form, and I always forget at the end of the event because we get kind of wrapped up really quickly. Please fill that out before you leave as well. So that one has a key question. What topics would you like to see or cover in 2018? What speakers would you like us to bring in? So we really need that information as well. So, since it's a holiday season, we're going to do introductions a little differently. I'm going to hand everyone the mic. We're going to walk around the room. You're going to tell us your name and your organization, and then please tell us briefly what services you provide or what gifts, since it's the holiday season, that your organization offers. So we'll start here.
My name is Kathy Wilson, and I'm the Development Director at Hope Center, and we offer free pregnancy testing as well as STD testing and many other options. And gifts that we provide, I think we have free hats, scarves, and mittens right now for babies and infants.
Let me just advise you, the microphone we're passing is because we're taping this. Yeah, it doesn't. It's not an amplifier. So please talk loudly. Just hold the mic near you so we can get your information for the taping. Thank you. Okay.
My name is Joy Tiernan, and I'm also with the Hope Center. And another gift we're giving is anyone who's enrolled in our Earn While You Learn program for ongoing parents or pregnant women or fathers. We're giving away 300 diapers this month.
Hi, I'm Ann Beckett, and I'm with Christ Child, as is Terry. We are co-chair of Layettes, and some of you have used our Layettes. And I guess that might also be our gift, because we give out about 700 a year. We're building to about 1,000 a year. And I'll let Terry talk about the other gifts.
What other gifts? I'm Terry Clark, and Christ Child also has other groups. In October we give out coats. I think we gave out about 4,000 coats this year, along with $20 vouchers for shoes or boots, along with hats, gloves, scarves, and mittens. And then we have backpacks, which also go to the homeless shelters, foster care, YWCA Crisis Center, etc. And the backpacks are gender and age appropriate backpacks and are just absolutely beautiful, full of books and personal hygiene items and stuffed animal. They're lovely. So and those equal about the same number as Layette. She does about 700 of those backpacks as well. So we're pretty busy in the community. We're in 23 agencies here in Allen County, and also we're in Auburn and Angola.
Hi, I'm Ann Keel from the Women's Care Center. We also offer free pregnancy testing, limited ultrasounds, parenting classes, birth preparation classes. Our gift is hopefully help for those in need. We also have a literacy program that is a little bit newer for us, realizing that a lot of the children don't have access to books. So we have book bins in all the centers, and all the clients and all the children are allowed to take a book every time they come into the center. So if anybody has books, I'll be glad to use them. And thanks to Christ Child Society, we also offer the material assistance through the Crib Club that they sponsor.
I'm Paige Wilkins. Oh, I was thinking it was going to microphone out. I'm Paige Wilkins, Director of Healthier Moms and Babies. I think the gift that we provide is really just giving our moms the support and encouragement that they need throughout their pregnancy, to know that they're going to have a healthy baby, and also have the confidence to know that they're going to be a good mom. Our services, do you need me to describe our services? Oh, no, okay. I think everybody knows what we do.
Hi, I'm Christine Meek from the Community Foundation of Greater Fort Wayne. I'm the Director of Community Impact. We don't give gifts, but we give grants, and this year we're on track to give out about $2.2 million to nonprofits located in Allen County, and we're pleased to be the primary supporter of the Allen County Children's Health Improvement Plan.
My name is Marlene Krause, and I'm the health coordinator for Bright Point Early Head Start. And our gift is that we provide encouragement and support to parents with young children so they become their child's first teacher and advocate.
Hi, I'm Lanissa Maggart with Early Childhood Alliance. I'm our family support coordinator, and so I oversee many of our family engagement programming pieces. We have Parents as Teachers, which is a home visiting program. We have Book Buddies, that's an early literacy play group for children and families. The gifts that we provide sound a little bit like what you're offering. Certainly early literacy pieces, books and educational materials to families, and then certainly support through home visiting prenatally through the child's entrance into kindergarten.
Hi, I'm Lora Ottenweller, and I'm a speech pathologist by trade, but I am also a clinical feeding specialist in the NICU for Lutheran Health. And I service mostly infants that have been born with some type of diagnosis or from a drug-addicted mother, and various kind of anomalies. So our gift is that we do give free bottles and services to our clients that have special healthcare needs and feeding issues.
Hi, I'm Julie Reese, and I work with Healthier Moms and Babies. I'm a nurse case manager, and Paige already told you what our gift is.
I'm Chelsea Harris, and I'm also with Healthier Moms and Babies, and I'm a case manager there.
And I'm Shirley Lothamer, and I'm also with Healthier Moms and Babies in the Nurse Family Partnership. I'm the nursing supervisor there.
I'm Ashley Nichter. I'm with Healthier Moms and Babies, and I'm a case manager there too.
I'm Elaine Williamson, and I'm with A Baby's Closet. And our gift is that the clients have earned coupons, and we have the goods for them to redeem them. And our gift between Thanksgiving and Christmas is that when they get a package of diapers, they also get a package of wipes, and we are also having a drawing for a double stroller.
I'm April Barkalow. I'm the Lutheran Health Network NICU educator. So we provide in-service or inpatient neonatal intensive care to our babies. And we don't give a gift specifically other than walking with the families through some of those really critical times in their lives and in their babies' lives.
Hi, I'm Stephanie Gehring. I'm the breastfeeding coordinator for the Allen, Noble, and DeKalb County WIC offices. So something, I'll let Abby talk about the general WIC gift, but from a breastfeeding standpoint, we do offer, I say it's one of the best gifts, the support for breastfeeding, since it's kind of the first step of preventative, but we do have the support of like the breast pumps and breastfeeding aids and supplies that we can get to our moms at no cost to them. I think that's a huge gift.
Hi, my name's Abby Morgan. I am one of the registered dietitians with the Allen, Noble, and DeKalb County WIC offices. I also hold the hat of outreach, and I also help on the breastfeeding staff as well. So I think we have a lot of gifts that we give our moms. Not only do we help them with the healthy foods that we give and all the breastfeeding support too, but one of our other gifts, I think, as well is referring to all of you agencies as well. We kind of act as a center to get them in the hands of everything that they need, and that way they can start out as healthy families and hopefully be successful. So,
I am Kathy Detweiler. I work for the Indiana State Department of Health, Maternal Child Health Division, and I think our gift is probably grant support and fund and program support for many of the organizations that are here. I wish we could do more, but we do what we can.
Hi, I'm Natalie Stabler. I work in the ECHO program through Catholic Charities. Main focus is to help young moms stay in school. We, for the Christmas, we do get a lot of local schools and agencies that donate gifts to us and we hand out to clients. And we do have a few that will adopt a family through our clients.
Hi, I'm Laura Price. I'm also with Catholic Charities in the ECHO program and a couple of other services as well. And Natalie basically covered everything that we've got going on, but we do also have the resource and referral program going on year-round. So for clients that are in need of utility assistance right now, we've got that covered too.
Hi, I'm Janet Elmer with DuPont Hospital. We manage the resource center here where we offer free classes for the community. A lot of our prenatal classes are for anybody who is wanting prenatal education. They don't specifically have to be delivering at our hospital setting. If they're wanting education, we want to be able to provide that for them. So, and again, all of our classes are free at our facility here.
I am. I'm Dana Wyant. I'm a labor and delivery nurse here at DuPont, and I'm also our bereavement and end-of-life coordinator for our perinatal patients. I work with bereaved parents that have either already lost their child or have learned that the child will not live long after delivery. I also work with moms that are pregnant again after a loss. I offer a couple support groups. As well as our program here, and I guess with gifts, we've been very fortunate with DuPont to offer a huge keepsake. What do I want to say? Just the keepsakes that we give moms. We use Resolve through sharing with the memory boxes and the folders that we're able to give all of our patients to go home with.
Hi, I'm Megan Smith here with DuPont Hospital, and I'm the team education coordinator. Just started back in October, so still learning the ropes, but like Janet said, a lot of the resources here are free, classes and that kind of thing.
I'm Pat McCullough, work here at DuPont Hospital in the Resource Center. I'm the program assistant, so part of the childbirth education. If you have any needs or questions, you can always call me and we can get things figured out for you.
Okay, where am I? Back here?
Hello, my name is Tanisha Clements. I am the coordinator for Park Center's 3 Wishes program. We are Park Center's early childhood program. Our focus is from 0 to 6. And in doing that, we also provide a therapy group for women who are either pregnant or have a newborn with mental illness. And then also starting in February, we will be providing a free support group for women with children who are dealing with mental illness.
I am Kristen Bunn. I am the CKF program supervisor, and it's a brand new title for me, sorry. And I work at Brightpoint, and I will let Amanda tell more.
I'm Amanda Chappell. I'm the Covering Kids and Families Program Manager at Brightpoint. So we do, through a partnership with Parkview Physicians Group, offer the presumptive eligibility for pregnant women, helping them get Medicaid and have that temporary Medicaid so they can start getting their prenatal care right away.
while they're waiting for their Medicaid applications to process, and then we help follow them through that application process so that they can get their Medicaid and continue having a payer source for their prenatal care. Brightpoint has a lot of different programs. So, I mean, the gifts that I would say that we offer, we might have some programs that have specific special stuff around the holiday, but I would say like our big push right now is probably the fact that open enrollment is right now for the marketplace. So we are, you know, really pushing to kind of offer that assistance to get health coverage, and then our energy assistance program. So we offer utility assistance from November 1st through, I think, May 12th. So just, I don't know, I guess we have a lot of different services, so a lot of different gifts and different things that we're offering through our different programs.
Hi, my name is Erin Norton, and I am with Parkview Women's and Children's. As you may have heard, we recently received a favorable response to our ISDH Safety Pin Grant application, and we will be utilizing community health workers in the community. And my hope is that our gift for women in the community and families is, you know, we are so blessed to live in such a resource-rich area that we can utilize those community health workers to connect women to all of you. So that's our goal.
Hi, I'm Terry Swim. I'm from IPFW, and I hope I give my students the gift of knowledge, but that's always up for grabs.
Good afternoon. My name is Connie Kerrigan. I'm the Director of Outreach for Parkview Behavioral Health, and we offer inpatient and outpatient services for women and families that are dealing with emotional or addiction issues. We also have care navigators who can help people navigate to the most appropriate level of care given whatever their mental health need may be. And I'm also the coordinator for the Child Fatality Review Team for Allen County, so working on those statistics as well for all ages of children.
I'm April Moore. I'm Director of Clinic Operations for SuperShot. We provide vaccines for children and adults. We can give vaccines to children that are on Medicaid, those don't have insurance at all, or those who have insurance that doesn't cover vaccines or doesn't cover specific vaccines, or their insurance caps at a certain amount for vaccines for the year. We can also serve adults that don't have insurance, or if they don't have insurance that cover specific vaccines.
Hi, I'm Stephanie Jones, and I'm the Education Coordinator for SuperShot. And I think April covered our services, but I know lots of your faces from going to some of your education classes where I go and just share about SuperShot and let them ask questions about immunizations and let them know about our services and hopefully connect them to some of you as well.
Hi, my name is Connie Heflin, and I'm the Executive Director for SuperShot, and I think April and Steph did an amazing job of telling you about our services.
My name is Michelle DeArmond, and I work for Lutheran Hospital. I run a perinatal mood and anxiety disorder program. We have a support group weekly, so I guess my gift to moms this year are my ears.
Hi, I'm Carmen Moore. I'm the manager with Parkview Community Nursing. I see lots of familiar faces in here. Our gift basically to the community is having Parkview Community Health Improvement that actually gives millions of dollars back to the community as our way of tithing back to the community. So that's a huge gift, and that supports a lot of your programs and our programs that covers women's and children's and new babies. So we're launching lots of new stuff over the next year, including the community health workers. Will be working under our lead to help connect all of us together. So working with Aaron and the rest of the Parkview leadership team, we're aiming to pour all of that back into the community. So.
I'm Jan Moore. I'm from Parkview Community Nursing as well. I'm the tobacco lead for our department. I'm the lead for Freedom from Smoking, which is the adult tobacco program. And hopefully in the first of the year, we'll be starting the Baby and Me tobacco-free program.
Hi, my name is Aisha White. I work with Parkview with Community Nursing as well. Work with SCAN, Brightpoint, and also breastfeeding support groups in the community.
Hi everyone, it's Heather Henry. I am the coordinator for Parkview Health Safe Sleep Program.
What we do is not only gift folks with pack and plays, but also the important information and resources throughout our community to help babies stay healthy and safe.
Hi, I apologize for my voice ahead of time if it doesn't carry, but my name's Nicole Folks. I am the Community Engagement Manager for United Way, Allen County's 211. What we provide is human and health services referrals, which means we help connect individuals with all of you guys.
Hello, I'm Tammy Taylor. I'm the Tobacco Sensation Coordinator for Tobacco Free Allen County. And I think that we give a lot of gifts, but I think you all, as Jan was talking about what she does, she also helps us help people stop smoking. And I think you guys are all of our gifts of helping us move that message around to help support people who smoke.
Hi, I'm Amanda Wyatt. I'm the therapist with the 3 Wishes program at Park Center. So I provide therapy services for children from 0 to 6, and then I also lead a group for women who are pregnant or new mothers that have mental health diagnoses. So I think the gift that we give to them is just emotional support, someone to listen to, and we also connect them with resources in the community as well.
I'm Megan Mullet, and I'm working at Park Center right now with Amanda.
I'm Angie Phillips, and I work at Lutheran Social Services, and we have many programs. Right now I'm with the ECHO Team Parenting Program and supervising the Gear Up Safety Program, in which we supply safety items in the home. That could include fire extinguishers, pack and plays, all sorts of different safety items to keep kids safe within their home. We have our Network for Safe Families and Community Partners program, our financial stability program. We also have our Balance Works, which is our counseling program as well.
My name is Beth Stutzman, and I work at a Hope Center. Joy already said pretty much what we do, but like she said, this month we're giving away 300 diapers to our Earn While You Learn participants who enter the drawing. So that's our gift that I'd say.
My name is Mary Wybrow. I'm from a Hope Center, and I do the events and communications. We also have a mobile unit that's going out into the community, and so our gift of our free services is going to them where they need it.
Hi, I'm Leanne Fritcha. I'm the nurse manager at Hope Center.
Did I miss anyone? Are we all good? Okay, start filling out your yellow forms, please. I know I'm shameless.
Hi, I'm Meg Disler, and I'm the director of the St. Joe Community Health Foundation. And I thank you all for taking a few moments and sharing your gifts, because we're about to hear a lot of sobering information that reminds us of all the needs out there. And rather than being discouraged, please be encouraged by all of the talents already in this room and gifts, and keep thinking, I know all of you do because I have had conversations with so many of you, how do we keep addressing the new challenges with what they're putting in front of us? I'm going to jump very quickly to keep us a little back on time. Dr. Sarah GiaQuinta is head of the Allen County Children's Health Improvement Plan. CHIP, not to be confused with the other CHIP you also hear about.
In the media a lot right now.
Yes.
That's not us.
But Sarah's been new to the community in the last year and brings a lot of gifts, but it'll do a quick overview for us on the 2015 infant mortality statistics.
Hi, thank you, Meg. And
this does not amplify, remind you, so talk loud. This will just make sure we get it on the camera for the video.
Okay.
Thank you.
Can everybody hear me? I'm going to do this without a mic. Okay. So yeah, just a shout out again to the Community Foundation. Without them, I wouldn't be here, and we are so grateful for their commitment to the health of children in the community. So today we're going to talk about infant mortality data from a children's health and public health perspective. This is really important because the healthier we make our moms and infants, and the healthier we make our children. So it's really a very upstream preventive look that we can take today. So before we get started, Let's start with some fun facts. In 2017, Fort Wayne was named the best place to raise a family. Did you guys know that? I didn't know that. I'm new to the community, so I was excited about that. We are known as a city of churches. Does anyone know how many churches we have in Fort Wayne? Wow, that is very close. 360. That's amazing. Our public library is one of the 20 biggest in the country. I didn't know that. I think that's great. And I think this might be self-proclaimed, but Coney Island says that they are the oldest hot dog stand in America. I actually tried to research to see if that was true or not, and I couldn't find any data to back that up, but I like that fact, and I think they have great hot dogs. So, all right, so on to infant mortality. Just before we go through these numbers, some of this may not be new information for you. Some of you it may be, so I'm just going to kind of start from the beginning. When we see these numbers, they are rates. So what that means is they are the number of infant deaths, so babies less than 1 year of age that were born breathing, essentially, per 1,000 live births. So does anybody know the United States rate? Have an idea? 6%. Yes, pretty much. Very close. 5.9. So that's a little small, but you can see that right there. So United States in general, that may not seem that bad, but it's actually one of the worst infant mortality rates among developed nations in the world. So we have some improvement that we need to do. Indiana, 7.3. So we are in this bucket right here among states in the United States. So Indiana has some improvement we need to do. If you live in the 46806 zip code, the infant mortality rate is 14.3, so double that of Indiana. And if you're an African American woman living in that same zip code, it's 22. So you can see that the numbers pretty dramatically increase based on your race and where you live. In the 46805 zip code, it's 11.4. And then in the 46805, if you're an African American woman, 26.5. Just to give you a scale, Cambodia is 26. So that's your comparison right there. So Allen County has 2 zip codes that are in the top 10 for the state, 46806 and 46805. So the other big ones are Marion County, but this is obviously a significant issue that we are facing, and that's why we're talking about this data today. Another quick note, this is all data from 2015. Some people say like, oh, get it together. Why are we so behind in our data? But that's actually the most recent data because you have to wait for the baby to be born and then have an entire year of life to make it to age 1. So we won't see 2016 data until probably next April because all the babies that were born December 31st, 2016, we need to give them a full year to see that outcome. So I was just on the phone with someone yesterday and they said, why are we seeing this? What is happening in this community? Not an easy answer. There's a lot of contributing factors, and this is kind of general information, so we can kind of jump into more specifics. So I don't have Allen County specific data, but in Northeast Indiana, pretty comparable to what we're seeing in Indiana. And your biggest bucket right there is those perinatal risks. So what that is smoking, alcohol, drug use, maternal age, spacing, so women are having a lot of babies really close together. Breastfeeding is protective, so if we're not breastfeeding, that's a risk. And then just maternal health prior to pregnancy. Your other big buckets are sudden unexpected infant death syndrome, SIDS, so that is 12%. That should not be ignored. And then congenital malformations. Those are your 3 big areas. So in Allen County, about 10% of pregnant women are smoking. 44% did not receive prenatal care in their first trimester. I think that's staggering. Almost half of our women are not getting in early to access care. 43% are for unmarried parents. And remember, this is all of Allen County as a whole. 17% of mothers were not breastfeeding at time of hospital discharge, and close to 10% are delivered preterm or before 37 weeks. Where it gets really interesting is when we start to look at things based on race, okay? So African American women living in our community, they are having more preterm births. They are not getting into early prenatal care like some of the other women in our community, and they are breastfeeding at much lower rates. So 32% are not breastfeeding at time of discharge, and a huge disparity between the white and African American race between those on Medicaid. The reason I think it's important to show this and talk about this is data. Well, the word kind of makes you feel bored just saying it. I think it really tells us a story. And so if we want to make an impact, we want to think about what we can do to make this change, we need to understand who we're serving and what is going to work for those populations. So if we go to our next one, looking at our neighborhoods, and this is all just census data. Everything that is presented here is free. I just got it online. There's a lot of wonderful databases you can go to. But in 46806, 40% are living below the poverty line. 51% are African American. They have lower levels of high school education, and a much higher percentage both of uninsured or on public insurance. So when I see this data, I think, would the same thing work to impact infant mortality in 46806 and 46805? I don't know, maybe, but maybe not. And I think that's where data can tell us a really powerful story, again, about who we're serving and how we can best impact those populations. The Indiana State Department of Health has a new data portal. So now you can go to it, and let me see if I can use my pointer. Oh, all right. You can do your county residence. You can see the state. You can look at the year. So if you want to get longitudinal data to see how we're doing. It has this 2016 column, which I just told you the data's not there yet. So I'm not sure if that's a running total or what that exactly represents. I emailed the state and they're still trying to get back to us. Yeah, yeah. But there is a lot out there that you guys can see and find to kind of help us understand what we're dealing with when it comes to this data. So I talked fast to be respectful of time, but does anybody have any questions or comments? Yeah.
And I just thought of this when the zip codes were up. Has anybody seen the zip codes for the entire state or specifically just Allen County? Maybe we could request that. I'm so curious to know what some of the other, like 46802, 46803, because when you look at the demographic from the same, like the population, it's actually worse in some areas in 46806. So I wonder what their infant mortality rates are.
Yeah, I have not seen the different. I've only seen the top 10. Me too. Yeah, so we can try and get that. And I think that this also is a challenge for us to, in everything we're doing, let's ask the questions and get more data. In the Indianapolis area, you can get a lot more data about living in that zip code, who has issues with housing, who has issues with food insecurity, who has issues with access to health care. And I think those are the kind of questions that we should challenge ourselves to ask and collect so that, again, we can really understand what the needs are of the folks that we're serving. So that's a good, yeah.
Thank you very much, Sarah. I appreciate that, and I think everybody else does too. Moving quickly forward, one of the things that she had said was the health of the mother, and so that's where we really get into sexually transmitted disease and sexually transmitted infection. And Kathy Thornson, who is actually, I've got your title right here, is officially the HIV STD Prevention Director of Fort Wayne Allen County Department of Health. And she's going to give an overview of what's really the good, bad, and the ugly, I guess, of sexually transmitted disease. And then we'll work through and explain that impact on pregnancy and some resources here that you can help your clients.
Okay. Well, thank you. It's nice to be here, and it's also kind of, even though data can be a little on the boring side, nice to do a presentation that doesn't have gory pictures and ruin all your lunches. So since Meg had asked to present the threat of STDs in Allen County, it seemed like data was the way to go for this crowd. So it's kind of short and sweet, and you will see a lot of things actually mirror what you just saw on the prior presentation. Getting started, I just wanted to kind of map it out for you so that you could kind of see where we are as a nation with sexually transmitted diseases, as a state, and then Allen County. CDC pretty much follows chlamydia, gonorrhea, and syphilis. They are the most frequently diagnosed STDs that we see in this country. Definitely gonorrhea, which is the GC column, and chlamydia, the CT column, are the ones that are by far the most prevalent of all. So if you can clearly see going down the middle column, gonorrhea nationally is at a rate of 111. All of these are per 100,000 population, so that we're comparing apples to apples all the way across, no matter if it's a large city or a little rural community. So Indiana's a little bit higher than national for gonorrhea at 119, and Allen County then, we just knocked the roof off at 183, unfortunately. The chlamydia rates, which is highly, highly prevalent, we started telling the lab, would you please clean off your equipment, because we were getting so many positive chlamydias back on all our results, but it's national. It's all over the place. Nationally, the chlamydia rates are at 456 per 100,000. The state of Indiana is a little bit lower at 436, and then Allen County at 542. And these were all based on the 2015 rates because that was the last full year of data that actually cleared CDCs. So the rest of the presentation that I'm going to share with you, I actually took provisional data. It's the data that we have that is current for this year of 2017 for the first 3 quarters of the year, which would be January to the end of September. This is a very informative summary chart, but I put in red probably what the threats were that we see the most and where our focus is as the health department currently, and hopefully as the community as well. The take-homes, I think, off of this would be definitely looking at the first column there, see if I can actually get the right pointer here. This column right here on the gonorrhea, just knowing that the 38% right there, that's a huge jump to see from one year to the next in just one type of STD. And then another take-home note would be over there in the far column in the notes, is that out of the gonorrhea and chlamydia that we are comparing in these 2 years for the first 9 months, we've seen a 10% of the gonorrhea and chlamydia for this current year, pregnant women. So STDs, we're finding them, it's good they're screening, but that's a much higher prevalence than what we would want to see, certainly, because of the negative outcomes potentially. The 11% overall is the increase that we're noting between the chlamydia and gonorrhea entirely as a whole, looking at all the numbers and all the cases, comparing the 9 months to the 9 months. Oops. So then I just thought I'd walk you through real quickly just the data specifically on chlamydia and on gonorrhea. But first, just to set the stage, again, it's knowing your audience, knowing the community that you're working with. And this is the July 2016 census data, just breaking out the race information. We see 80% population here for Allen County is listed as white, about 12% black, 4% Asian, and 4% other. Which when we follow through with the first one going through gonorrhea, looking at an age breakdown, we definitely know that communicable diseases, specifically in the STD world, are highly, highly impacting the younger population. 24% of the gonorrhea cases to date out of that 674 cases are under 20. Those are primarily our teens and younger. 56% are in the 20 age group. We do a lot of targeted efforts on the under 25 population because that is really where the bulk of all STDs are found. To look at racial, just putting the pictures beside each other, when you see our breakdown as a community and then you see our breakdown of gonorrhea cases, huge disparity piece going on there, absolutely, that you just see visually there in that chart. To have 57% of the gonorrhea cases within that 12% of our population, huge disparity, which needs looked at and worked on. The chlamydia age breakdown then, flipping to the other disease we see an awful lot of, we've had over 1,600 cases at the end of the third quarter. Higher in the younger under 20 population is at 30%. 58% are then in the 20s. So almost 90% of the population, we're talking about under 30, where we see the STDs. And those are the patients that all of you can potentially focus on and work with risk reduction messaging. This wants to go from an angle here. The other piece that I added here was just, again, so on chlamydia, you can see that overlap of that disparity issue. It's just so visual when you try and lay the pies over each other.
The purple is black, the blue is white population.
Yes.
I'm not sure if everybody
can see that. Yeah, definitely. And the other piece, just you being the group you were, I thought you might have interest in just a little bit of the information on the 230 pregnant cases that were diagnosed in the first three quarters of this year. They were the ones that had gonorrhea, chlamydia, or they could have both. 41 of them were positive for gonorrhea, 189 for chlamydia, and of course we have the dual infections as well. So it is good that STD screening is part of the prenatal care. It's essential because they are finding infection there. And just a little information on HIV is that we've had 27 cases to the third quarter of this year. It's up a little bit, again, from where it was last year as well. We still see most of our HIV cases, though, within the men having sex with men population. It is kind of a good thing this year, though. We're also seeing a lot more African American individuals step up and test. So not that we're glad to find the positives, but the fact that we know that we're reaching and getting testing done in a community that was a little bit harder to reach or slower coming than other areas that came to test earlier. So we continue to see some female HIV infections as well, but predominantly the men having sex with them, men having sex with men population. It's so hard for me. We always call everything by STD, MSM. Everything's a buffet of alphabet. And the last thing to just share with you is that all of you, if you're in areas or offices or work with testing of any sort, just remembering that they are reportable. Our laboratories do a great job of reporting. Doctors' offices, too, are part of that reporting rule for the state of Indiana. These are our two DIS that handle the STDs. It's Pam and Corinne. Some of you probably have talked to them on the phone, but they do the follow-up to make sure individuals that we get the reports on actually have the right treatment, that they get their partners taken care of, they get their education and their questions answered as well. And they can be reached at that number at any time. And that's it. You guys have any questions? I feel like we're driving fast on these. But
no, you did great. You got us back on time. Please, yes.
I have a question.
Yeah.
Do you know why you think that our STD rate is higher here? Is it a lack of resources for young girls to be able to get into care, or do we think that unprotected sex continues to play a larger role in our area? Do you have any data to show that correlates with that?
That behavior stick is much harder to measure with the resources that we have. Definitely the sexual activity is there, just we see by the age groups that we're seeing the reports in. Access to care, we all know a lot of the schools kind of shifted with hours. I can just speak from our clinic perspective. It's a lot harder for my investigators to get the contacts in at times where they're available now. The ones that are in school age, it's a challenge if they're in school till 4, and then if they play sports, they're not in the hours that we are. So, you know, we have to look at things, and that's one of the things we're looking at right now is making a shift to kind of reach some of that. Thanks.
questions? Questions? Dr. Lora Overton is a OB-GYN physician and who's worked a lot in this, well, you've dealt with a lot of clients with these kinds of issues, but will walk us through why this is such a big concern to our pregnant women a little further.
So I tend to walk and talk. So just so you know, one of the things that we do, like Sarah and both Kathy alluded to this earlier about CDC. So I get a lot of my data and information from the CDC. So when I want to update something, I pull up a CDC website and get that information. Two things that I pulled up, one of which I'm going to leave with Meg for your offices or clinics or pregnancy resource centers if you want to have. And again, you can get this off the CDC website. One is just the information about infant mortality itself. And this is 2014. I think you had 2015 data. So they said over 23,000 infants died in the United States in 2014. And again, 2015 data is probably what's new and updated. But what I want to emphasize here is this section right here that says, what are their causes? First cause that they put there is birth defects. And again, this is from the CDC. Second cause that they put there is preterm birth. Okay, preterm birth. So that brings up this handout right here. So preterm birth, what are the causes of preterm birth? Okay, so you get first social, personal, and economic characteristics. I think you guys talked about that well enough. Low economic status, but then they talk about medical and pregnancy conditions. First thing on the medical and pregnancy conditions is infections. So I had a young lady ask me one time, she said, so what's the big deal if I've got chlamydia? You can just give me antibiotics and I'll be fine. Well, that's great and that's fine. But I think Kathy talked about the, 10-11% increase in STDs in pregnant women. And I want to talk about just one little thing that anybody who's had a baby knows about. And that's that mucus plug, right? Yeah, gross. That mucus plug. Everybody knows about the mucus plug, right? Because when you lose the mucus plug, that is an indication that you may be going into labor. What most people don't know is that the infections like gonorrhea, like chlamydia, like bacterial vaginosis, like trichomonas, okay? But we talk about gonorrhea and chlamydia because those are the two bad actors. Eat away at that mucus plug. And that mucus plug is not just there to tell you when you're going into labor, it's there to protect that bag of water. Okay, so it sits in your cervix and it protects that bag of water from trauma, from, when you have sex, it protects that bag of water. If an STD or any kind of infection eats that mucus plug away and removes your protection, then that makes it more prominent or more capable or more apt to let your water break early and go into labor early. So one of the things, and Joe, you can talk about in your classes when y'all are seeing these pregnant women is pay attention to your mucus plug, okay? A lot of women don't know that. They're just happy that they've lost it so they can have this baby. They don't understand that it's a protective effect. So I don't have 15 minutes of lecture. I just have remember the mucus plug, okay? Remember the mucus plug. If you need this, again, Meg will have it.
And we will make all of these handouts available and the PowerPoint. We do put them on the website. That's kind of Faith. You can go to them anytime, and we will email out a link to all of this in the next few days as well. So,
thank you.
I will introduce you very quickly. Joe Faulkner is head of a Hope Center, and I'll let you run. You're ready to roll.
I had never heard that. I really appreciate it. It's like every time we get together, there's always one more thing to learn. I will say that all of the statistics that you've heard go right down the line with what we are doing at a Hope Center. We had 1,200 clients who came in and got tested for chlamydia and gonorrhea. 93, just like they said, right at 10%, 93 of them were positive for pregnancy and chlamydia or gonorrhea. 14 were positive for all three. So we are fortunate. I'm just going to tell you a little bit about the things that we are able to do. We are able to send everybody who has a disease or an infection, we're able to send them after we have tested them, after we've talked to them. We send them to the health department because we have vouchers so that they can get medication. Our vouchers came from the St. Joe Foundation, and so they're able to get medication so that we are able to prevent them from having any kind of premature labor from an STD. according to, let's see, it is the American Medical Association Journal of Ethics, they said that if a baby is born at 28 weeks, it costs approximately $1 million in hospital care. So because these girls came to us and they tested positive, 93 of them, we were able to save our community approximately $93 million. And so that's huge, because then we're able, instead of having to worry about taking care of babies in NICU so much, maybe we can do something that will help prevent all of this from happening. And I appreciate all of the statistics and the data, because it backs up everything that we have at the center. And so we have a mobile unit now, and it's a medical mobile unit that also has an ultrasound. We're also doing pregnancy testing, and we're doing STD testing on it. We're also linking up with the health department. We're going to be talking, they're going to come and do full panel STD testing and stuff over at Calhoun Street, and we're also going to eventually do some things with them with the medical unit. But right now, we've had the medical unit out a whopping 68 hours. We've had 48 visitors. 75% of them are positive for pregnancy and gonorrhea or chlamydia. And so going out into our community seems to be helping a great deal. And also the fact that we're going to be able to help, the fact that we are going to be able to give them an opportunity not to have a premature labor, and the fact that everybody was talking about gifts and everything, the fact that we can also give hope. You know, that's the gift, and I know it's a hope center, but that's one of the gifts that we give. This isn't the end of the world kind of thing. We can help, and we are here to help, and that's one of the things that I know every one of us sitting here, that's our desire, is to help and to see what we can do to change these horrible statistics and to do the things that we can do to help our clients. And so I just want to tell you all thank you, thank you, thank you. Also, it was so good for me to sit here, because I ran all my statistics this morning, and man, they're right down the line. So that's what we do. And anybody who's wanting to partner with us, because we're going to, right now we have a mobile unit that we're using 2 days a week, and come January we're going to start fundraising for one of our own, so we'll have it out 4 to 5 days a week. And so anybody who wants to come partner so that we can go in and help as much as we can and help our pregnant women and also help our community and our babies, we're available. So thank you.
Thank you. Thank all of you. We have a great panel here of experts and wonderful speakers. We can open up to questions. Is there anything you want to ask about their services, about the statistics, or about what could be done? Now's the time. Yeah, go ahead and talk, because I'll have to give them the mic.
Recommendations for the treatment of sexually transmitted diseases. It's online. Anybody can reference it. 2015 is the current issue that's being used. There are specific sections even for pregnancy. Rocephin, along 250 milligrams of Rocephin, along with 1 gram of azithromycin, is the recommended treat for a pregnant individual. And they strongly encourage using dual treatment because of the STD issues that are going on in this nation, because we're seeing a lot more resistance. Just in the last month, they actually had 2 resistant cases of chlamydia that are resistant to azithromycin, which they just identified. So when they're at least doing the dual treatment, what one can't get, the other can. Those are medications that have been safely tested with pregnancy, and they actually have the backing for that. So that really hasn't been the issue. It's more of a very lackadaisical attitude of, well, it's only chlamydia or it's only gonorrhea. And there's this issue of, well, when my boyfriend's available, we'll try and come together to get treated, where, you know, I don't know. It just, there's a lot of excuses that come up in between. So my investigators, they're constantly, you know, okay, you missed that appointment. Let's schedule you again. And if he can't come, we'll schedule him on another day. Let's get you taken care of. So it's more in that issue.
It's about data. Oh, and chlamydia and gonorrhea are both often symptomless, which is another lack of reason not to. So do we have a sense of the reinfection rate? So I'm guessing partners are not getting treated as much as the women. Do we know how many women are coming in and just maybe being repeatedly treated based on the partner not being able to be treated?
We weren't able to pull that data ourselves right now. We use a state database, but we were looking at that as well. And I got a preliminary to that question back, which showed in 2017, we had only had 56 cases, and this was male and female, it wasn't broken down by gender, only 56 cases that were repeat cases within the same year. So that really doesn't seem to be the issue, and hopefully we're not seeing resistance in this area either, is what that's kind of telling us. That was our other concern.
And also, we're getting ready to, we're doing a partnership with the health department as well. And our first phase is, of course, to get mama tested. And then if she comes back positive, our second phase is to get her partner tested. And then maybe eventually do both. But right now, we're making sure mama is healthy. And then we're doing stages of how we can affect both partners.
Okay, I have a question. I'm going to take advantage of a dear friend of mine. But I think it's such an important issue, and part of it is what happens to that infant once it's born. So can you just tell us a little bit about NES or whatever?
Okay. Oh, thank you for putting me on the spot. Well, obviously, in our practice, we see a lot of NAS babies, which are your babies that are born with substance abuse, and we have seen quite an increase. We have a program through Dr. Turner right now who are treating moms with different medications to decrease the withdrawal of infants that are drug addicted. In addition, and one of the questions I was actually going to ask is about our Burmese population, which I'm also seeing an increase in our practice. And do you see or have you more involvement with these individuals because they're coming into our hospitals with no prenatal care? They have children that are born with birth defects, with their preterm, and have multiple issues. And of course, the language barrier is always an issue with the Burmese population. So we are highly impacted as a unit, as therapists, as physicians, by preterm infants, as well as infants born with infection. And these things don't go away fast. They have long-term effects. And of course, that's part of my job to treat these infants so they have the best outcome. But it takes all the resources that we have to have the best outcome for these kids. And I could go on, but I know one of our biggest issues is getting good prenatal care. And it's still amazing to me that even in our hospitals, we're still seeing moms without any. So whatever we can do to increase the prenatal care, I think we have less risk for the preterm infant and the ill preterm infant.
Which hospital are you at?
I'm at Lutheran, but I service St. Joe, DuPont, and Lutheran NICU.
So does anybody want to take the Burmese question?
We are seeing an increase in Burmese. What we have noticed is it seems to come in floods. It's like one neighborhood will tell everybody in their neighborhood, and then when those babies are born, then it stops, and then a few months later we'll see another flood. The other part of your question with regards to prenatal care, I think one thing, where's my Brightpoint people? We are so appreciative because when they come into our offices, we can hook them up with Brightpoint because the number one concern of theirs is I have no insurance. And so the fact that we can get them hooked up and let them, Brightpoint take them through all of the resources that they have, that's been helping a great deal as well. So I know it's still out there, but we're hacking away at it. Yes.
Hire a Burmese bilingual that we're training as a navigator now.
Wonderful.
The Medicaid portion of it.
Wonderful.
We'll just soon be doing more of that, but I don't
Right.
Hooking these women up with doctors sometimes is difficult because of proximity and maybe where it's most convenient for them, only a male doctor delivers, and that's not always the best option due to culture and religion. But I mean, we're breaking down some of those barriers,
Mhm.
and the other resources could say that too. But we are excited about that because we are training her right now, so we're hoping soon to, by the end of this year, have her available to start doing more Burmese Medicaid navigation.
That's great.
My question is for the Burmese, where I'm a little confused on, because we service the Burmese pretty significantly for just up until about a year ago, and they were typically the most compliant with going to prenatal care. So are we seeing a higher rate of them with STIs? Is that what you were saying, or is it just a higher rate of Burmese delivering prematurely? And is there any way we can get that data from Department of Health? Because I know that when you get the data from DOH, I always go to your website to show how many babies were born prematurely. Could we have that broken out by race?
I can certainly ask it. That piece actually they get off of vital records, off of the birth certificates, not within our clinic side of things. But Dr. McMahon is always very focused on getting all that information. Burmese go into the racial categories of Asian for CDC. So, I mean, you kind of have to make a little assumption there, too, when you see Asian. But when you look at 4% of our population Asian on our census, and we're looking at about that same percentage for STIs. I could tell you in our clinic, we obviously have the refugee clinic where, they get that initial care, when they first come to the country, or even some of the secondaries as they relocate here will find our clinic, and they go through, the whole immunization, the health thing, the TB, they go through that whole line of screening with us initially while they have that insurance component. But then, there's that handoff, where they're with a navigator and they move down, kind of into more of a traditional role, where we don't see as many Burmese then in our STD clinic, which is amazing.
When they are coming into the clinic to be tested, how many of them are positive with positive? You can always email me that, but I'm curious
Yeah.
to know what percentage are Burmese. We've seen a higher increase within our Burmese population.
Yeah, that's the statistics that I would have to get to you. Mm-hmm.
They need to be educated on that.
Sure,
That
sure.
is becoming a trend.
Mm-hmm.
So, sorry. Very good question.
Yeah, real good question.
Any other questions? All right, thank you so much for joining us today. Happy holidays, and thank you for saving babies. Oh, an optional tour and eval forms. Okay, I'm still relentless.